I'm Dr. Eric L. Johnson. I am with the University of North Dakota School of Medicine and Health Sciences and Altru Health System in Grand Forks, North Dakota. Some strategies that I think about when I'm talking about vaccines in general with persons with diabetes is just to make a note that they're due. Our electronic health record highlights that for us, so I can actually show that to the patient on the screen, and we can have a conversation about which ones would be important for them. If they're due for 3 or 4, they maybe don't want to do them all in a day, but we'll put them on a schedule so they can get them done. These vaccines are important for persons with diabetes. They're more likely to be hospitalized, and they're more likely to have emergency room visits if they're unvaccinated. And of course, being vaccinated keeps those numbers lower. There certainly seems to be a reduction in hospitalizations and emergency room visits. People are also less likely to die from the illness itself, like pneumonia, RSV, COVID, or influenza. So it's important for these patients to get these vaccinations. If they're not going to the hospital and they're not going to the emergency room, of course, costs are going to be less as well. In the standards of care, we know that RSV is a newer vaccine. That's currently recommended for persons over 60, which includes persons with diabetes. Influenza is an annual vaccine for most, and COVID appears to now be an annual vaccine with some boosters for higher risk people, and that likely includes persons with diabetes. Motivational interviewing is used for lots of health maintenance topics like tobacco cessation, for example, and you're meeting people where they're at right now. So they may not go for it today, but you might be able to move them along from pre-contemplative to contemplative stages, and hopefully we can get them vaccinated in a timely fashion. The most effective facilitator to drive vaccination, I think, is to really be behind the vaccinations. I want to share the science with persons, and I also want to let them know that I'm vaccinated as well. I think that's a very powerful message for most persons with diabetes.